Okay, welcome everyone. My name is Fahim, Fahim. I'm one of the full-time trainers here in Medlink. I was a paramedic for 10 years in a CDF. Now I mostly do the online learning and sometimes I teach. So we only have 1 hour. I'll try my best to cover all of the topics. I think we can do it in an hour. You have any questions at all, please go ahead and ask me. If I don't know the answer, I will tell you. Okay, so let's do a check-in first. I'm going to launch a poll, and this is a poll right now. How is everyone feeling today? Please go ahead and answer the poll. Good. Don't worry about saying that you're not doing too good today, even though there's a chance your boss might be here. Okay, just making sure everyone is okay, comfortable. This is a safe space. Um, we will try to learn as much things as we can today, okay, in this 1 hour. Good. All of you seems to be, most of you seem to be. That's nice to hear. Okay, now, next question. I want to ask you another thing. Okay, so I have another poll right here. Let me share the results first. Okay, oh, one person said not you. Well, okay. I don't know if I have the private DM function available, but if you have anything to ask me also, you can go ahead and ask. Okay. Now, second question, I'll ask you, which topic are you most excited to learn about today? Now, there are numerous topics I'm going to go through with you all. And these are the 5 different topics. So which one are you most excited? Okay, good. Okay, what happens in public areas more often is actually right now heart attack and stroke, based on my experience. So it's good that everyone gets well informed in every of the topics. But some of the topics I will share with you, I'm very passionate about. Is stroke and CPR AED. So let me share with you the result. Okay, good. Now, let's go on and start this first aid awareness talk. Okay, I'm going to start with stroke. So when someone has a stroke, and if you don't know, stroke is one of the top 3 causes of death in Singapore. Stroke-related complications leading to death is right now, based on last year's statistics, I believe is the 3rd highest cause of Singapore. Happens all the time. Even when I was a paramedic, at least once a week, I would attend to a. There are 2 types of stroke cases. The first one is ischemic stroke. I'm going to annotate here. Okay, anything with the word ischemia or ischemic means blood. Okay, for some people who have high blood pressure, what happens is that doctors are supposed to give you blood in the blood. And if you don't take your blood thinners, the blood can just clot in your body. If the clot travels to your part of the brain, gets stuck there, that is ischemic stroke. Okay. Hemorrhagic stroke, there are 2 explanations. There's the medical explanation. When you have high blood pressure, as your heart beats, there's the friction. This friction can actually tear the walls, and eventually there's a complete tear, the blood will start to leak out. Okay, you can also get hemorrhagic stroke from trauma case. So say you hit your head, you bang, say you're in a car, there's a car crash, you bang your head, that can also cause. Okay, it doesn't really matter what is the type of stroke, signs are all the same. So I'm going to show you the signs of stroke. F. Okay, we do this assessment all around the world. Even as a paramedic, I will do this fast assessment. Okay, now at the end of the theory, this 1 hour, I will email you the PDF version of this slide so you guys can every now and then refer to it if you need to revise. Okay, now F is face. We look for the drooping of one side of the face. If the right side of the patient's face is having the droop, it means that the clot is at the other side of the brain. Okay, some patients they sort of have like this resting droop face, so you need to get them to smile, and then when they smile, you'll see that one side isn't really moving. Okay, A, we check the arm strength. Some patients won't be able to listen to your instructions. So instead of getting them to lift up their both hands and hold there, what I normally do is I get them to grab and press and squeeze my hands as hard as they can. Okay, normally the weakness at one side is very obvious. If you're a big paranoid like me, what other things I do is I push my hands against their knees. I get them to push their knees up, and then the one side is also very weak. Okay, so you can do the arms test, you can do the knees test or the leg test also. Now the speech, when they talk, because of the stroke, will be very slurry. It's very obvious. Okay, some relatives they call for say fever. In Singapore, fever is considered an emergency for an elderly. So when I assess the patients for their fever, I realize they might have some slurry speech. So I will ask the relative, like, did your mom previously have a stroke? If they say no, this is the first time that hearing this slurred speech, then assess for stroke, which is quite common. Okay, because sometimes they might not have the weakness, they might not have the droop, but based on the slurred speech, it's really an indicator of a mild stroke. Okay, and then time, the last one, is very important. The downtime is 5 hours. Okay, sometimes within 5 hours, the stroke onset happens, and then treatment is done at the hospital. Because of the fast treatment, the damage reverses, and then the person, the signs previously that was present, disappears because of the circulation. Now, I'm going to show you the different treatments I'm going to explain to you. So for ischemic stroke, let me annotate. This ischemic stroke, what they do is they give medication at the hospital to dissolve the blood clot. Okay, for hemorrhagic stroke, they give medications to promote blood clot. These are the two different treatments depending on the type of stroke. After the treatment is given, they will send for X-ray, confirm that the treatment has been done successfully. Now, there is also a chance, say you see your colleague have a signs of stroke, very obvious, left-sided facial droop. At the same time, the left part of the body is very weak. You call 995, but when the 995 arrives, everything disappears. Your colleague's back to normal. Okay, that is possible. That is called a acute stroke. I'm going to write it down for you. Transient ischemic attack. Okay, this is an acute stroke. So imagine there is a blood clot inside one of your brain. Okay, this blood clot here. The tissues around start to die. The signs start to appear. Okay, as your heart pumps blood, there's a chance that the blood clot comes out. So even though previously your colleague presented with signs of stroke, because of the blood clot coming out, the signs disappear. You need to go hospital. Why? Because they need to dissolve the blood clot. If that blood clot, as it goes on a holiday, if it goes into the heart, you can get heart attack. If it goes to your lungs and it gets stuck there, you can get something called pulmonary embolism. Essentially, you stop your breath. Okay, so this is stroke. Always in Singapore, the top 3 causes of death every year. Okay, what happens if the person doesn't get treatment on time? Say this person has been having stroke for 8 hours. Even though the clot or the wall has been cleared, what happens is that the damage is permanent. The droop remains, the weakness remains, the decline happens. This person now has to be on a wheelchair, has to be on a bed, cannot really talk properly, cannot walk, has to go for physiotherapy sessions 3 times a week for many years just to move a bit. Okay, so if you see someone on a wheelchair outside, there's a very high chance it's because of a. Any questions for stroke? It's very, very common. Our peak period, the timing that we always respond to a stroke case is in the morning, 7 a.m., 8 a.m. What happens is that they always get the stroke during sleep or before sleep. Okay. So your actions to take. DRS ABC is one of your, as a first aider, your bread and butter to assess a casualty. I will show you, I will explain to you how this DRS ABC is done later on in the slides. Okay. Manage any injuries that a person has sustained. Why? Sometimes the stroke is so bad, it happens when the person is standing and it will make them fall down. Okay, why does that happen? Because if there's a stroke, your brain handles a lot of different functions, your breathing, your cognitive functions, your walking, your standing. So if there's a clot there, you might fall down straight away. Okay, so there might be some injuries. If the person conscious, you sit them up so that they can breathe properly. If they are not conscious, place them in recovery position. Recovery position basically means to turn them to the side. Okay, what happens when you have a stroke onset? There'll be a lot of saliva buildup in the mouth. And then when you turn them to the side, you let all the excretion come out. And then you just monitor their level of consciousness. Don't give them anything to eat or drink. Why? Because after treatment in hospital, they'll send them for a scan. Okay, so nil by mouth. Okay, any questions for stroke? Very passionate about stroke. I cannot tell you how many times I've attended to a stroke. Okay, sometimes the stroke cases is very rare. For example, this person has a stroke on both sides. So the whole body is weak, the group is on both sides, slurry speech, and the person will not be able to talk to me. The two different ones. Okay, let's move on to diabetes. Now, in the world of diabetes, there's actually a lot of different types of diabetes. Okay, we're going to focus on type 1 and type 2. Type 1 is you're born with a pancreas that can make very little or no insulin at all. Okay, type 2 is over the years when your pancreas starts to make insulin that doesn't really work anymore. Okay, so type 1, they need to inject insulin before they eat. Type 2, they need to take a pill to sort of strengthen their insulin. Okay. Anyone not sure how diabetes works? Basically, when you eat any carbohydrate, any starch, noodles, pasta, sugar, your body digests this sugar into glucose. This glucose is in your bloodstream. Okay, it just circulates in your bloodstream. What it needs your pancreas to release insulin. The insulin will attach to the glucose to send them to the cell. Okay, so in the world of diabetes, there's only two emergencies, either when you have too high sugar or too low. Okay, so say one day you're a 55-year-old lady who don't take care of your diet, and then suddenly one night your insulin just stops working. You'll start to wake up confused, drowsy, there's too much sugar in your blood. Okay, so hyperglycemia is when there's too much sugar, usually from undiagnosed type 2 diabetes. Okay, some patients who are diabetics, they fail to take their medication or insulin when they eat, or they naturally will overdose on glucose. How do you recognize? It's very simple. Okay, just remember, high sugar, you'll be very warm, you will have high fever, your breath will smell like sugar, or your breath will smell like fruits. Hypoglycemia is on the other end of the spectrum. So instead of being very hot, the person will be very cold. He might be also a bit confused. And instead of the breath smelling like fruits, in hypoglycemia, your breath will smell like metal. Okay, imagine those doing the keto diet or the low carb diet, or people who fast, their breath will smell like metal. Now, the treatment, to be honest, there's only treatment for hypoglycemia, low sugar, depending on their conscious level. If they can listen to your instructions, they more or less will be able to drink sugary drinks. Okay, if they cannot listen to your instructions, you can't really do anything except call 995. What the ambulance will do is they'll insert sugar into their veins, using a needle. It's called a dextrosaline. And then this sugar, once given, the casualty will more or less wake up. Okay. There's this other treatment for low sugar. If they cannot listen to your instructions, and if the paramedic cannot get the vein in, the needle into the vein, what we do is we put honey under the tongue, because there are some capillaries underneath your tongue that will absorb the honey. Okay, we use the honey sachets. Every 995 ambulance will have honey sachets. Okay. Now, for high sugar, hyperglycemia, you can't do anything. Just call 995, monitor the casualty, keep looking out for their breathing, and then you can't give anything to drink. Now, this medic hours card, let me annotate this. This card, you find it um, patients from marginalized communities, those who can only speak dialect, like can only speak Hokkien, Cantonese. So the social worker, at the void deck, some HDB void decks have those social welfare organizations. They will print this medic hours card because of the language barrier. So this card will have their medical history, their drug allergy, the medications that they take. Okay, so in case you can't really communicate with them, all the information you need will be on the card. Okay. Now, speak talking. Okay, another, I would say it's not really very common for 995 ambulances, because I feel like if anyone chokes in public, right, definitely someone will step forward to do the abdominal thrust. Okay, I've attended to some, I was making my way to some cases, and then they will call the 995 operator. They say, oh, we don't want the ambulance anymore. The person actually stopped choking anymore. We already did the abdominal thrust. So we don't actually come, we will just go back to our fire station. Okay, so choking, the person will not be able to speak, he won't be able to breathe, he won't be able to talk. Now, if he can, it's called a partial obstruction. Your brain's reflex is to get you to cough if the food touches near your airway used for breathing. Okay, so naturally, as a person, you will cough. If it's a complete obstruction, you will not be able to speak, breathe, or cough, and someone has to do abdominal thrust. First and foremost, we always do abdominal thrust. Why? Because when you do abdominal thrust, you're sort of like pushing against the diaphragm to get the food to come in. Okay. In the medical terms, we call this the Heimlich maneuver. Okay. In the simple terms, we call it abdominal thrust. Let me show you a video on abdominal thrust. Okay, please let me know if you cannot see the video, if you cannot hear.
Medical emergencies, choking. The universal sign of choking is when the casualty grabs their neck with both hands. They will look like they are in distress and will not be able to speak, breathe, or cough. To help the casualty, you should do the following. Approach the casualty from the front. Identify yourself and ask if they are choking. If the casualty nods their head, go behind them using your dominant foot. Ask them to spread their legs about shoulder width apart. Place your dominant foot between their legs for stability. With your hands at their waists, palms open facing upward, trace horizontally towards the front and locate the belly button with your ring finger. Your index and middle fingers should be placed just above it. With your dominant hand, make a fist using the 5-4-0 method. Place the thumb side of your fist above the two fingers. Using your other hand, place it on the casualty's shoulder and ask them to lean forward. Once the casualty has leaned forward, use your free hand and cover the fist. Do inward-upward thrust until the casualty coughs out the object or they turn unconscious.
Okay, so that was the abdominal thrust. If you watch those videos on Facebook, I don't know about you guys, my Facebook my demographics there are all like paramedics, nurses. So they tend to share those videos of people choking in emergencies. If you've seen those videos, when someone chokes, they don't really do this universal sign. They just like this, and then they just like struggle. And then someone straight away just goes behind and then tries to do abdominal thrust. I think that's fine also. You don't have to necessarily like think about this. Okay, so that was abdominal thrust. If the person is a bit big size, you cannot put your hands around. There's no space. Or if the person's pregnant, you do not want to harm the baby, you have to do chest thrust instead. So next, I will share you the video. Pass.
Medical emergencies. Choking for pregnant or obese casualties. The universal sign of choking is when the casualty grabs their neck with both hands. They will look like they are in distress and will not be able to speak, breathe, or cough. If they appear to be visibly pregnant, or you are unable to wrap both arms around the abdomen, you can assist them by doing chest thrust immediately. To help the casualty, you should do the following. Approach the casualty from the front, identify yourself, and ask if they are choking. If they nod their head, go behind them using a dominant foot. Ask them to spread their legs about shoulder width apart. Place your dominant foot between their legs for stability. If you attempt abdominal thrust and they brush your hands away, check with them and ask if they are pregnant. If they confirm that they are, proceed to chest thrust. Using your forearm, raise the casualty's elbows about 90 degrees. With your dominant hand, make a fist using the 5-4-0 method. Place your fist in the center of the casualty's chest and use your other hand to cover your fist. You will need to lean your chest against the casualty's back to act as a backboard. Do backward thrust until the casualty coughs out the object or they turn unconscious.
Okay. So that was the chest thrust. Now I will email you guys the PDF version, so you guys can revise on the steps after this. So the steps are the 2 slides after this slide. So this is the steps for abdominal thrust. Then the next one will be the steps for chest thrust. Okay. Now, when you do either one of these thrusts, either one of these methods, there's only 2 outcomes. The first outcome is the food gets to come out. The person will right? But if the food do not come out, the food just remains there. The person will eventually turn unconscious because there's no oxygen entering. Okay, and when a person turns unconscious, you're supposed to do these steps. We call this the SSCAB model. Okay, it looks exactly the same as CPR, and it is exactly the same as CPR. The rationale for doing it is different. We perform these chest compressions to get the food to. So naturally, if you see someone on the floor, this person is not breathing, and you didn't know that this person choked on something, so you start to do CPR, do not be surprised that the food will eventually come out. Okay, what else happens when you perform CPR? The rib cage will fracture, the person might pass motion, pass urine. If the lady is pregnant, if the casualty is pregnant, eventually the fetus might come out. Okay, these are all the things that may happen from dying and from CPR. Okay, but this is chest compression. It's sort of different from CPR, but the technique, the execution is all the same. Okay, now you can read this all in your own pace. Basically, to summarize, as the person turns unconscious, we catch them. We catch them, we don't let them fall down, we support them on a firm flat surface. Second S, shout for help. Give your instructions to people around you. You call 995 for ambulance, and then you get the AED. Okay, and then you start to give 30 chest compressions. After you compress or you press the chest 30 times, you check the mouth to see if the food's out. If there's nothing in the mouth, you repeat your chest compressions. So it's 30 chest compressions, check the mouth. Nothing in the mouth, compressions, and then check the mouth again. As long as you remove something from the mouth, you would then check for breathing. Okay, if the person's breathing, means you save the person. If you remove something from the mouth, you check for breathing, and then the chest doesn't rise and fall. This person's not breathing, means the person has already. So you then go back to your CPR instead. And then by then, the AED would arrive. Okay. So this is what they mean by unconscious choking. Move on to the next. Okay. Now we're going to talk about burns. Most commonly, burns are caused by dry flame scalding by hot water. Okay, sometimes radiation, like from sunburn. If you use a cold compress on a bruise longer than 20 minutes, you can actually get cold burn. Okay, we classify electric burns as well, and certain chemicals can cause burns also. Okay, in burns, when we talk about burns, there's actually 4 degrees of burns. Okay, but in first aid, we only cover 3 degrees. So first degree will be red, can be painful. A very bad sunburn is also considered a first degree burn. Okay, second degree is when there's blisters. So as long as the bubbles form, it's already considered a second degree. Okay, why do the bubbles form? It's because it's your body's way of protecting you. So it forms a bubble because the most common complication of a burn is infection. Happens all the time. I've attended to a very bad burn case, and this person survived actually. I resuscitated her back to life, but eventually she died from infection. Okay. Now, third degree is it will look charry. The person will smell like barbecue, and then it's painless. Okay, why is it painless? Because the nerve endings will all be burned off already. Then the fourth degree is usually where you can only see the bones. There's no more flesh. Okay. Now, treatment for burns, quite easy. We use the 4 C's. The first C is to cool under room temperature water for 10 minutes. Okay, the second C is to clear any jewelry or anything else that can continue to burn the area or might further irritate the area. Okay, but if say your watch is stuck with the skin, please do not pull out the watch. Go and get treatment at the clinic. Okay. The third C is to cover. Honestly, I will only cover a second degree burn when the blisters start to pop. Then I would cover because I wouldn't want it to get infected. Okay, I won't really cover a first degree burn. What happens when you cover a first degree burn? Moisture starts to form, and then this moisture can actually make the burn much longer to heal. It happened to me before. I had a burn, like a first degree burn around my arms, and then it took like a few months to heal because I kept covering it. And then I realized when I air dried it, I removed the bandaging, it recovered much faster. So the fourth C is to consult a doctor if you're not sure about your burn, if your casualty is a child, or if you're in doubt. If you have a child or if your burn, you're not sure whether is it severe or not, just go to the clinic. Just go and see a doctor. Okay, so we use these 4 C's for burn injuries. Okay. Now, apart from burns, I want to talk about common open wounds. Okay, abrasion is when your skin gets scraped off. So if you ride a bike or if you fall down, it's very common. Okay, an incised wound is a very small cut, and a puncture is when something enters the skin layers. Okay, it doesn't have to go all the way through. If something's embedded in, that is also considered. Okay, now for all of these wounds, you can clean the wound. You can even use tap water in Singapore. It's quite clean. But if you can, use either those distilled water or like normal saline, the healthcare grade. These two are the best. If not, tap water is fine. You clean, Apply pressure. Say my injury is at my palm here. Clean, apply pressure, elevate higher than my heart. Okay, higher than the level of my heart. And then you want to cover with band-aid after that. Okay, so this is the treatment for any form of wounds. Okay, anything with a bruise, pain, or swelling, you can apply a cold compress. Okay, but make sure not to put longer than 20 minutes because it can cause cold burn. Okay, any big bruises, especially on elderlies, you might want to consult a doctor because elderlies, they bruise easily. And then if the elderly has secondary illness or any other medical history, might cause the bruise to take longer to heal. Okay, it can also lead to some other complications. Okay, now we are at the last topic for today. I got a question to ask you. This is my favorite topic in the world of first aid. In all of the medical emergencies, this is my favorite topic, CPR and AED. I actually remember how many times I encountered or attended to a cardiac arrest case. It is about 150 in 10 years, which is actually a lot. Okay, I had a lot of cardiac arrests. So normally as a paramedic in Singapore, right, you only attend cardiac arrest, I say once a month. But for some reason, I think I'm very unlucky. I got like 3 to 4 in 1 month. So it came to a point where I started to keep a journal, and then I wrote down every cardiac arrest, and then like anything interesting that happened in that cardiac arrest. I jotted everything down, and it's very important to do something, especially CPR. So I'm going to ask a poll. I'm going to ask everyone a poll right now. Prepare to answer the poll. It's regarding CPR and AED. I've launched the poll. So if you saw someone outside on the floor and this person's not breathing, would you do CPR? You'd not. Okay, you can just answer honestly, it's fine. Okay. I know why most of you wouldn't want to do CPR. You're afraid you do the wrong thing, number one. You're afraid you harm the person, number two. You're afraid you'll worsen their condition, three. Mostly it's because you guys are not sure if you're doing the right thing. Okay, I clearly understand. I'm here to help you to mitigate that. You do not need a CPR set actually on CPR. You just need to know this. If no one steps forward, right? Say you see someone on the floor, there's a group of people around, and no one steps forward. It's better for someone to do something. Okay, I'm going to share the results so that you can see. Okay, next question. Next question. This is related. It's a continuous version of question 1. What if no one else steps forward to do anything? Okay. Oh, someone said I will still not. Okay. 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 I'm going to show you the results. Okay. Now, I'm going to show you this very important video. Okay. The government actually, they produced this video and it's based on a true story. It's about this lady, this makcik, who is CPR certified. And she went on to sort of save this person. Something happened and then she helped. They made it into a movie, into a video lah, basically, to encourage the members of public to learn CPR. When I first watched this video, actually I cried because it made me think about the cases that I went for. Now it's in Malay, but there's English subtitle.
Sejak kecil lagi, saya nak ikut jejak langkah abah saya. Itulah yang mendorong saya nak jadi sukarelawan macam dia. Dalam kursus sukarelawan itu, saya belajar kemahiran CPR untuk menyelamatkan nyawa. Siapalah tahu kemahiran ini berguna satu hari nanti. Bila saya keluar dari stesen MRT, saya nampak ramai orang kerumun seseorang.
Excuse me, uncle, let me help. Auntie, auntie.
Saya pun mula rasa penat. Nasib baiklah ada orang lain tolong juga. Dengan pertolongan seorang pemuda ni, kita ganti-ganti buat CPR.
Hello, 905, outside Bombay MRT station.
Sehinggalah ambulans dan paramedik datang, terus bawa mangsa ke hospital. Sejak kejadian itu, saya tak henti-henti fikirkan tentang si mangsa. Saya tak boleh tidur buat beberapa minggu. Tak pasti macam mana khabar dia. Abah pernah pesan tentang pentingnya tolong orang lain di saat yang memerlukan. Abah memang seorang wira. Kalau Abah masih ada, tentu Abah bangga dengan saya.
So this is the real footage of the incident. It happened in I think like 2000s.
Yang saya gembira lah yang dia selamat. Dia masih boleh bersama keluarga, anak-anak dia, maybe cucu dia ke apa.
Nina, ini adalah mangsa yang anda dapat selamat.
Oh, Lily, Auntie, how are you?
Fine, thank you.
这样你很有心呢，谢谢你这个这个路面那么深，我很感谢你。
Memang lama ni apa yang saya cari-carikan jawapan tu dah jumpa Auntie. Sihat. Alhamdulillah sihat.
So this is CPR and AED. Okay, you can save someone just by performing CPR. Even if you do it wrongly, what will go wrong? What will happen is that someone that's more qualified might see you doing it wrongly, and then the worst thing is they'll come and they'll tell you that they want to take over the CPR. Okay, but if not, it's very important to do it as soon as you see the person isn't breathing. Okay, when the person's not breathing, the chest don't rise up and down. It's already a criteria. You can do CPR already. Okay, I want to talk about the survival rate of dying from a heart attack outside of hospital. The chances of survival is actually only 7%. We had a heart attack, a cardiac arrest outside the hospital. Okay, this 7% is very low. We still try to preserve, we still try to save the person, even though it's only 7%. Okay? Okay, risk factors. What causes someone to get a heart attack? What increases the chances? Smoking is one of them. For some people, basically, some people smoke up to 90, 100. Nothing happens to them. What happens when you actually smoke? Toxins can, it will go to your organs and eventually you start to breath. People who have diabetes and the diabetes is not managed well, the complications of diabetes, one of them is heart problem. There's also nerve issues, kidney issues, problems with feeling pain, and then eyesight issues. So diabetes itself has 5 complications. Now, high blood pressure, I already mentioned, just like the stroke case, if you have constantly high blood pressure, your blood can clot, and then say your blood clots, it travels here, and then it just gets stuck here. And you're so unlucky, you have build-up of high cholesterol levels here. This is what causes heart attack. Okay, that doesn't mean if you don't have high blood pressure, you cannot get heart attack. It's common, sorry, it's quite rare, but it happens. Say your blood pressure is in a normal range, 100 over 70. You can still get heart attack. It's just a bit rare. Okay. Okay, what are some other risk factors? Genetics, lifestyle, sometimes even the food that we eat. Okay, so certain races, they consume foods higher in oil. So naturally, they are higher at risk of getting heart attack. Okay, next. So this is the state of heart attack. It's just like the clot getting stuck in the brain, but this is when the clot is stuck in your arteries. Okay, eventually, your tissues will start to die off. Your heart reacts by beating much faster. After it gets too tired, it slows down. Okay, and eventually, when most of the heart has already died off, so to recognize a heart attack, the person will have 2 major signs. He will sweat a lot, and he might feel pressure, pain, can be tightness, can be discomfort at the chest, and it will radiate to any part of the body. Okay, how long the heart attack will last depends on the individual, usually longer than 20 minutes. So you confirm, you've already established this person, based on his signs, he's having heart attack. You should sit him up. Same thing, get someone to call 995 for ambulance, get someone else to get the AED, and if they have this medication called GTN, glycerol trinitrate, to give. You cannot give your own GTN, they must have the GTN themselves. Okay, patients who have history of chest pain, doctors will prescribe them this GTN. And the doctor will tell them, okay, wherever you go, you must bring this in case you get a heart attack. Okay, so this is the spray form. This is the tablet form, and it's always given under the tongue. Okay, because it's under the tongue is sort of thought to be fast acting. And just monitor them while waiting for the ambulance to arrive. At any point of time, if the person stops breathing, straight away perform CPR. The faster you do CPR on a person that has stopped breathing, the higher the chances that they will be saved by you. Means if there's some delay, if you hesitate for a while, and then 2-3 minutes later you will eventually perform CPR, the chances of survival for that person drops significantly. Okay, so we talk about heart attack. The person is still conscious and talk to you, but it's about in cardiac arrest, the person will not respond to you. At the same time, he won't be breathing. Now, earlier I mentioned the DRS ABC being your bread and butter when you assess a casualty. Now I'm going to show you a video on how to perform the DRS ABC. So this is the video.
Medical emergencies. 2-man CPR, hands only. If you come across a casualty, check for danger before approaching. Next, check for response. If there's no response, shout for help. Identify someone to call 995 for ambulance and get the AED. Check for breathing by looking for rise and fall of the chest for not more than 10 seconds. If no breathing, start CPR by placing the heel of your palm in the center of the chest, lower half of the sternum, interlocking your fingers. Lock your elbows and use your body weight to do compressions. Remember, The depth of compressions should be between 4 to 6 cm or 1/3 of the casualty's chest. Compressions should be done at the rate of 100 to 120 compressions per minute. When the second rescuer arrives with the AED, check for danger. Ensure that there is no water, metal or flammable gas and inform the first rescuer. AED is here. Continue CPR. Take the AED out. Pads should be placed below the right collarbone and below the left breast. Switch on machine and follow instructions. When the machine prompts to assess heart rhythm, shout, "Stand clear! Do not touch patient." If the AED says shock advice, with one finger on the shock button, looking at the casualty, ensuring one more time that nobody is touching the patient, push the shock button. After the shock has been delivered, start CPR immediately. The second rescue.
Okay, so I'm going to stop over there because what happens next is a bit confusing. But more or less, that is what you do in a two-man rescue when the person isn't breathing. So when you do CPR, one person will do the CPR, and the second person will come in and perform the AED. If any of you are tired, really what happens is that they swap roles. So these are the considerations when you perform CPR. The landmark, where do we press? Because a lot of people are very scared. They don't want to do step forward. They do not want to do anything because they are afraid they press the wrong place. Right? Just remember, it's always the heel of your palm, center of the casualty's chest. Heel of your palm, center of the patient's chest. You interlace your fingers, lock your elbows, and then go over the person directly. And then using your body weight, you press down and up, 4 to 6. Okay. Now, to be honest, for those who come down to our class for the 3 hours course, they practice, right? But nothing will prepare them for when it actually happens. It's always very different when it actually happens. When you perform CPR on our mannequin, the mannequin's chest goes up and down. But when you press on your own chest, your chest will not go up and down. Okay, so it's very different. So honestly, the best way to practice is to do it on a real casualty, provided they really stop breathing out. Okay, so don't worry about doing the wrong thing. As long as you aim the center of the chest, and then you should be fine. So once you start performing CPR on someone who isn't breathing, you can only stop when the person shows signs of life. Now, how would they normally show signs of life? They will start to breathe again. And when that happens, you're actually doing CPR, right? So you need to be attentive. You can feel the resistance when you're doing CPR. Okay, then you stop your CPR. What are other signs of life? They'll open their eyes. They won't really talk to you. Depends on the downtime. Usually they won't talk to you. They can only open their eyes or they'll just start to breathe. Okay, you can only stop CPR when the ambulance comes and take over from you. EMS means emergency medical service. Okay, you can also only stop when the AED says it's analyzing. So let's go on to AED. This machine, we all know what this machine is. Some of you may or may not know the functions of this machine. Okay, this machine can analyze your heart. All of us, our heart has this electrical rhythm. This machine can read the rhythm, and depending on the rhythm, it will give a. Okay, not every rhythm the machine can shock. I know in the movies, right, the person's dead, right, and then the straight line, and then they shock. But in real life, a straight line is not a shockable rhythm. Okay, so the machine will analyze or read the heart every 2 minutes, and then when it's not reading the heart, CPR must be done. Okay, so maybe just now there wasn't a shock given, and then you do CPR for 2 minutes. There is a chance because of your CPR, the next analysis, the person will be in a shockable rhythm, and then the machine will shock. Okay, so these are the steps. The AED is analyzing. Stop your CPR. do not let anyone touch the casualty, because if they touch during analysis, it might interfere the rhythm. Okay. Every analyze is either a shock, no shock, depending on the rhythm of the casualty. But if it's a shock, the machine will first charge. Okay, when it's ready to be pressed, it will blink in yellow, and then just make sure you stay clear and make sure no one is touching. Then you shock. Okay, after shock given, continue CPR. If the analysis is no shock advice, continue CPR. Okay, stop the CPR and AED when the AED says analyzing, and the paramedic comes and take over, or when the person starts to have signs of life. So say you save this person. Normally, we do not turn off the AED. We just leave everything on. Why? Because if this person has previously died, his heart is not strong. He can just die again anytime soon. And the machine is stopped straight away. Okay, don't be worried. Don't be anxious about using the machine. The moment you turn the machine on, right, instructions will be given to you on what to do. Okay, these machines are made to be idiot-proof. Anyone should be able to use it. The instructions will be very clearly given to you. You will repeat and repeat and repeat and repeat and repeat the instructions until you do it. And then the next set of instructions. Okay, so don't worry, oh, I never used the machine before. Don't worry. As long as you turn it on, it will guide you. Okay. So what we watched in the video just now were the two men rescue. This slide here shows the two different steps depending on either you're doing CPR or are you doing the AED. Okay. Okay, I've already finished. Are we on time? Yes. We have 6 minutes left. Anyone has any questions they want to ask me regarding anything? You can ask me questions on this on the topics we covered today. You can ask me on anything else. Anyone? How about Varuna? Any questions from you?
No, I'm all good, thank you.
Okay, great. I'll leave the Q&A open, but if there's nothing else from anyone, then can I get everyone's help to scan this QR code? This is the feedback code.
Fahim,
yes, Mr. Jun.
we've got a question over here from a group of us, right?
Okay. Yes.
Just out of interest,
yes.
We want to know what is the success rate reviving a person from cardiac arrest when you perform the CPR. Like, because you said general, like the chance of a person surviving outside hospital is 7%.
Yes, correct. Are you asking in general or are you asking my success rate?
Your success rate.
Okay. To be honest,
of the 150 that you did.
Okay. Out of 150, I managed to personally resuscitate 30, which is very high if you think about it. But it's nothing to do with skill, it's all purely luck. So, especially my first year. My first year, I almost quit because I had too much cardiac arrest. And out of my 20 plus cardiac arrests in my first year, I managed to resuscitate 15 of them, which was very, in that first year, even though I wanted to quit, right? But it was because of the amount of people I managed to resuscitate back that stopped me from quitting. And then after that, throughout the years, right, I think I just got quite unlucky. The success rate dropped and dropped and dropped. But to be honest, out of these 30 that I personally resuscitated, I do not know how many of them are still alive.
Okay, right. And another question of interest, right? What about legal liability when you administer CPR? If the person dies, right, will it come back to you to say that, well?
Okay, very good question. I have never encountered that happening in Singapore. I know it happens in other countries, but it hasn't happened yet in Singapore. I think there are laws in us, even if you do not have a CPR cert, because out of goodwill, you're helping when no one else steps forward. So I think it hasn't happened yet in Singapore.
Okay, that's good to know. Thanks, Fahim.
Thank you. A lot of people are very scared because to do anything purely because they do not have the CPR. Okay, even if you do CPR as a first aider, right, when the police comes, the paramedic comes, they will not ask you to furnish out your cert to prove. That doesn't happen. Yeah. Okay, if there's no more questions, help me scan this QR code. do the feedback form for us. I like the two questions though. Okay.
I
Thank
have
you
a
so
question
much.
for him.
Yes, ask me.
What about baby or kids? Can I do like choking? What happen if they got choked?
Okay.
Baby.
How old is the kid?
Like maybe 2 years old, 3 years old?
Okay, so we actually teach choking for infants, but infants are 1 year old and younger. Now on Google, right, you can actually Google to find out how they do it because it's very lengthy. You have to do the 5 back blow, 5 chest thrusts. If the 2-year-old or 3-year-old is a bit bigger size, you can actually perform the steps as I showed you just now. Just don't press too hard. So you can actually do on 2-year-old, 3-year-olds abdominal thrust, but just don't press so hard. It's much lighter, and then the foot should come out.
Okay.
And if the 2-year-old turns unconscious, you can follow the same steps in the unconscious choking, the SSCAB. But when it comes to the compressions, right, don't press too. Maybe half the pressure you would normally do on an adult.
Got it.
Thank you.
Thank you.
Yes. Okay, I'm going to go off video, but I'm still going to be around up to like 1:05 if anyone has any questions. Okay, thank you so much. I will send you an email of the PDF for the slides that we went through today.
Thank you very much, Fahim.
Thank you.
Thank you.
Bye.